So how do you know if you have venous insufficiency? Well, you'll probably feel a dull aching, heaviness, or cramping in your legs. Your legs will swell up when you're on them too long. Your legs may itch or tingle. Pain will get worse when you stand and better when you raise your legs. Your legs and ankles may also be red. You may notice skin color changes around your ankles. You may see varicose veins on the surface of your legs. You may feel thickening and hardening of the skin on your legs and ankles.
The difference between spider veins and varicose veins are that spider veins are simple little purplish veiny looking things underneath the skin. Varicose veins are bulging veins that you may feel underneath the skin. So for patients who have discomfort in their legs and varicose veins, we would recommend that you come in for an evaluation and we can decide what type of treatment options are available for you. Depending on the type of varicose veins you have or the severity of your varicose veins, we may offer a minimally invasive surgical option. For simple spider veins, we can inject them with a variety of solutions. After the injections are completed, we would wrap your leg with something similar to an ACE wrap. You would go home and have no activity restrictions for the completion of the day.
It's important to know what causes the development of varicose veins. Your veins carry blood from your capillaries to your heart. In your leg, this means the blood has to flow upward against gravity, so the veins in your legs have one-way valves called flaps or cusps that prevent the blood from backflowing and pooling. Over time, the valves can fail to close tightly, allowing blood to backflow and causing veins to become engorged. This causes the bulging and twisting that results in painful, unattractive varicose veins. So how does a laser work to fix this problem?
All it requires is local anesthetic, just to numb the area up, and a tiny little skin nick that doesn't even require any sutures. You just pass a little laser fiber into the vein and you use ultrasound to visualize the little laser fiber and position it precisely. And once you turn on the laser energy, you can ablate, meaning close down the vein thoroughly, and that's all done in less than an hour without any significant discomfort or anesthesia.
I had the Venicure procedure on a Friday. Friday afternoon, I was walking, I was shopping, I went out to dinner that night. On Saturday, my family and I went on a hike. On Monday, back to work like normal.
Typically with varicose vein disease, that includes a thorough physician examination documenting the location and size of the veins and whether they're on one leg, both legs, whether they involve just the upper, lower, or the feet and the ankles or everything. And unless you utilize an ultrasound to examine that underlying vein condition, you're not going to effectively treat the patient with the right form of treatment, and you're also unlikely to get the end result that you're expecting.
Hello everyone, we are talking today about a very important subject to those of our viewers who suffer from varicose veins and spider veins. And the subject is, how do you choose who should treat your varicose or spider veins? What are the questions that you need to ask when you walk into a practice to determine is this a practice that can really help you? So I've invited Dr. Jose Almeida, who is a board-certified vascular surgeon and is world-renowned for his work in all kinds of vascular surgery, but especially in varicose veins. And thank you for joining us, Dr. Almeida.
Thanks.
Okay, so what are these things that we need to ask to choose the right person to treat us?
Thank you for choosing this topic. And so if you're a patient, you're entering a vein clinic, you should really just ask a few basic things, and they really all involve, is your doctor properly credentialed to do these procedures? So number one, what the type of specialty? In my mind, of course, I'm a little biased, but vascular surgeons, that's vascular, blood vessels, and surgeons we train to operate would be the most qualified. We know how to do catheter-based procedures, we know how to interpret the imaging, we know how to operate and use catheter-based technology. Does the doctor have hospital privileges? Why is that important? Well, hospitals vet you. One has to go through a credentialing committee to get privileges to do these procedures. The other thing is the ultrasound examination is important, and your vascular lab needs to be accredited. That guarantees that you've gone through rigorous protocols and that the information that you base the diagnosis on is accurate. Another thing that we're seeing out there is patients being told they need 4 and 5 ablations for treatment of their varicose veins. We do these procedures at one setting. On average, we'll ablate one vein or maybe 2 veins in the same setting and remove the varicosities through something called a phlebectomy. So it's really one and done. So these are really the key things that if you have a vein problem, you should be asking.
Thank you so much, Dr. Almeida.
Now you decide if you'll accept a free leg exam by a local doctor near you. All you have to do is click below on Learn More and tell us when we can give you a call to schedule your absolutely free, no-cost leg exam.